When we talk about healthcare safety, what does it brings in your mind? If you are a healthcare professional, first thing it strikes at you is your patient safety. And that too in the hospital or your clinic. And then you start thinking in terms of accreditation, the protocols, everything related with that. But your mind goes towards the healthcare safety processes and systems in the hospital clinic setup. But what about the healthcare safety at your own home? Hi, I'm Dr. Neha Agrawal, a clinician turned healthcare safety and on a journey to transform the challenges into milestones for healthcare professionals by helping them build their own online digital business for their personal and professional growth and with resultant safer healthcare systems in the country and the world. I would share few important pointers related with healthcare safety basics at home. And the healthcare safety basics should start from your own home because it happens so that we are running in this busy world and we take care of our patients, but multiple times we forget to take care of our own self and our own safety processes at our own home for our loved ones. So I would like to stress upon few pointers. One important point is the fall prevention. The other is few pointers related with medication safety and few pointers related with old age people and the diabetic people and hypertensive. So let's begin with how to prevent the fall. I am here going to stress upon the fall prevention at home. Most important thing is having the area clutter free, having in the night a night bulb on, especially so in elderly room. The passage should be lighted. Even the passage between the room and the washroom, if there is a corridor, that should also be kept lit. And whenever anybody is getting up in the night, make it a habit and brief all your loved ones that first in the night they should sit for few seconds in the bed and should not get up suddenly because at times it may create dizziness and person can fall. Another point is pass urine before going to bed when you are going to sleep. Even if you are middle-aged person, but most of the time the falls have been seen to occur in the early morning hours in the night because the person gets up to pass the urine. This is very important. Anyone should in the house wear a well-fitting slipper and make sure you are not using the same slipper for a long time, and multiple times it will happen that your slippers will be okay from above but their sole will be all become plain and become more slippery. So you need to change your slipper regularly, and more so it should not be loose, it should be fitting, and more so in elderly people. You should have a grab bar at the toilet area and also in the shower area. Multiple times we talk about this in the hospital, but many of us don't have these grab bars in our own home. And the fall can occur even in any person. Any person can slip in the toilet area. Other thing is, if it is possible and it's okay, then have a cubicle in the shower area so that the water when you are taking a shower does not spill all over the bathroom. If it is possible, it is better to do it, or as soon as you take the bath with a wiper, the water should be dried up. When you are on any medications, then make sure that again you are more cautious, especially if you are having any sedatives. Another point is, if you are short-sighted, then wear your glasses and the specs of appropriate size. Next point, if for some reason any plastic or paper falls on the ground, please pick it up immediately, as if it remains there on the floor and your foot falls onto that, you may slip, more so with the plastic paper. And it has happened in my own relation, where my niece has fallen down because of this reason, and she fractured her kneecap because there was a plastic lying on the floor and she slipped on it. So please make sure these things don't occur. At times things will fall, but immediately that plastic paper has to be picked up. Any spillage of water or any liquid on the floor has to be cleaned then and there, has to be dried. Everything is important for older people, but it applies for younger people also and children also. It's good to have strong bones. People must take the calcium as per advice by the physician, especially so post-menopause females, which makes the bones stronger. Another point, have strength making exercise of legs, because you must have the stronger legs. Only walking does not make your legs muscles stronger. It will definitely be stronger in the person who walks than in comparison to the person who does not, who keeps on sitting. But you must do some muscle strengthening exercise on regular basis so that the gait is okay. These are few important points related with prevention of fall at home, and you must brief your loved ones about these. Then, talking about the medication safety. Medication safety, we expect that everything should be done at the level of the doctors. Yes, they should be doing it, but there are certain our responsibilities also when we are at home. And one, for you visit any doctor, first thing, while a doctor is writing, it is your right to, you can ask your doctor, in fact you should ask your doctor if they are writing with the pen, and if you see they are not writing the prescription in the capital writing, the drugs, then request them to please write them in the capital writing, or give them you the printed typed prescriptions. Another thing is, if they are writing OD, BD, TDS, request them that they must mention whether it is twice a day, 12 hourly, thrice a day, 8 hourly, or HS if they are writing whether it is in the night. It is very important, because you will not always be as healthcare professionals. If you are not with your loved ones, they may make a mistake. And when they are going for buying the medicine at the pharmacist shop, if the writing is not clear, the wrong frequency also can be given. OD may look like BD. So something which has to be taken once, it may look like, and they may start taking it twice a day. Request your doctor to write the main side effects of whatever medication is prescribed to you. It is the responsibility of the doctors, but feel more responsible for yourself also, and you can ask them and they can write it there. telling by verbal method can again make people forget. And it has happened with me also. Even if I am a doctor, when I have gone with my mother at for some physician visit, because at times the doctors think that since the doctor is accompanying the patient, then that person will remember. But at that time, the healthcare professional is a patient relative and the mind is somewhere else. So this is very important pointer. Always request your doctor, even if you are a healthcare professional, to please mention it on the prescription, because you may forget it later on. Any side effects, or in what situation you should visit, in what emergency or situation you should visit the hospital in emergency or urgent care. It is important, if the doctor is not asking, also to tell whatever medication allergies you have had. Any past illnesses or treatment, even if it is not you feel that it is not related with the present illness, you must tell it to your doctor on your own. Doctors always ask, but at times you may think that this is the past, that treatment was long ago, so you may not say it, but you must tell it. You must tell each and everything to your doctor. When at home, we talk about look-alike, sound-alike medications to prevent the errors that you are not taking the wrong medication. But what about at home? At home also you should have a system, and you should brief your loved ones also, so they can take care, especially so in old age also, but even younger people also this may happen. If they are similar looking, like either the strips or the ampule, vials, the bottles with the tablets, if anything is like that, have a system of having the separate place for morning, evening and night medications. If as such also, it is better to keep little apart, especially so in the older people. And if the same look alike the medications, have a permanent marker, OHP permanent marker, and mark it with a specific color code, that with different colors, and you keep it at a separate place where they will be at separate distance place. And you can mark the strip also, and you can mark the like in for morning, evening, night, you can mark with different colors. And those which are look alike or sound alike type, you have to mark with the same color, so that when you pick it up, you will get the alert, oh, this is the same color, I have to cross check again. And you have to keep this look alike and sound alike medications far apart. So make it a habit of keeping it at separate place. You can have a sticky note where you can write it, that what colors you have written for sound alike or look alike, and what colors you have made it as a standard for morning, evening and night medications. And keep this color as a standard for everyone in the house, so that it will become a habit and everybody will know that this is the morning medication, this is the evening medication, this is the night medication. Why I am telling this? Because this has occurred with my brother, where the mistake has occurred by the look-alike bottles. And let me tell you, this does not happen only in India, it happens abroad also. And I have witnessed it abroad also. So do not think because the human beings are everywhere same and the errors can occur. So make it a habit. Another pointer in medication safety is, if you for some reason forget to take any medication, meaning you don't forget, you are not sure whether you have forgotten, whether you have taken it or not, it's better to miss that medication, especially so like the anti-diabetic medications or antihypertensive, because double dose will be more harmful. If you've been taking the medications regularly and at one time if you miss, if you are not sure, it's not going to harm you. But this habit should not be there, that every time you forget and then you don't take the medication, then this definitely going to harm you. So again, I am telling you this because it has happened with my brother only. So I started making these system and processes because he thought that he has not taken these medications, and he was on metformin 2 tablets at one time, and he took 4 together. And then although it is said that metformin as such does not cause low blood sugar, but then if it is taken in so much of dose and the person is also eating less, it will all depend upon, even this will cause the low blood sugar. And that was also happening in my relative. And then I kept on asking them, and they kept on checking the sugar, and then I had to made him have the ice cream which was kept at home, because that was the night time when they were going to sleep. So if the person sleeps, does not come to know, then it will be more detrimental. So made him eat so many chocolates, so many the full cup of ice cream, then, and asked him not to sleep till his sugar was at least 130, 140, because otherwise it was coming somewhere around 100 or something. But with so much of chocolates and so much of sugary things, his sugar only came up to 120, 130, and in the morning also it was just less than 120, somewhere between 110 and 120. So do not take it that metformin does not cause low blood sugar. If it is taken in excess amount, and other condition will also make the difference. If the person has been eating very less, thinking I'm a diabetic, I have to eat very less, that is also very detrimental. Please make sure they are taking enough calories. Not too much, but consult your doctors what minimum calorie you have to take, because if by body system your sugar is increasing, then the drugs will be added. But you cannot think like this, that you reduce your calories so much that you become so weak. It happened with my mother. Well, that she was becoming weaker and weaker, and when physician asked her what she was eating, because everybody is thinking she's eating, and she herself is reducing her diet, thinking I'm diabetic, if I eat more. She was not taking any sugary thing, that is good, but otherwise she was eating too less, and it was hardly not even 1000 calories. So the doctor accordingly prescribed, and now she is okay. So these are in the medication safety, some important pointers. Then as I am saying some points about the diabetics. So definitely all medication safety prevention fall is applicable to everyone, but for diabetics, the foot care is very important. So one has to, when after taking bath, one has to wipe, when has wiped the all body area, the foot area should be wiped with another dry towel, because sometimes if a long standing diabetic, there are neuropathies, they will not come to know, and with the wet area, if there are small pricks or anything, then dangerous infections can occur. So this is very important. The diabetics should not walk barefoot. That is also very important. If the diabetics should always carry, wherever they go, they should always carry a Glucon-D, a spoon, a glass and bottled water, and testing device, glucometer and the strips, and whenever they have some signs, the diabetics get used to know, they know when they feel different or ghabrat or some weakness, they come to know that maybe the sugar is getting low. But if you can check it, then they check it, and For some reason, if it is that the glucometer is not there, so they must eat something or take that glucon the packet with them, I mean spoons of sugar, and immediately make it a habit to check it again, because by experience and with the long standing diabetic, they come to know that yes, now the feeling what they are having is because of low sugar. But too much of sugar, that is also to be avoided if you have not tested your blood sugar. And it is always better to have higher sugar at that moment than to have a low sugar, because low sugar is very detrimental. And as healthcare professional, all of you know this, but you must brief this to your loved ones. One another pointer that is for diabetes related. And now if we talk about elderly people, so all those medication safety prevention of all is there. One important point is preventing the hyponatremia, the low sodium. Now most of the time, elderly means generally people think after 60, but this may even occur in 45 plus, 50 plus also, depending upon how the person is taking the diet, or how they are, what their exercise level is, what is their losing of sweat in summers, or what kind of work they are doing, and how much they are eating, how much salt is being put in the diet. Every time people think if somebody has blood pressure and hypertensive, they reduce the salt too much. The salt intake has to be normal. It is not to be the added salt or extra salt. And so that is one concept. They reduce salt so much, then at times in the younger age also, the middle age also, there may be a low sodium, and if too much of low sodium is there, even unconscious can occur. It's very important. And then certain drugs, medicines also can reduce your sodium level. So, as the age increases, our taste of salt, to tolerate it starts decreasing. And the older people, or even after beyond middle age, people start reducing the salt intake, because they start feeling the taste alters in most of the people, and they start taking less of the salt. And with the age, the diet also decreases. So now the salt intake becomes less. So one has to really take care, and in regular, at least if not 6 monthly, for diabetics, hypertensive, old people, at least annually once. If it is controlled, then at least annually once. And in diabetics, at least 6 monthly, the investigations should be done, all panel, depending upon what is the condition is. And the sodium level should also be done. Sodium, potassium, and everything should be done. I'm telling you this, why? Because that's also from the experience from in my own family with my mother, where she was not able to eat and not able to take the salt so much. So on a regular basis, every day, I have asked her to take in one glass of water, the lemon and the salt, which keeps her salt level okay. Her salt level still now comes at somewhere around, the lower limit is 135, so it comes around 132, 134, something like that. So this is very important to understand. Do not think that, and my mother is a hypertensive, she is a diabetic, and also a atrial fibrillation patient. But her BP is controlled, and it's not that she is taking on regular basis this salt that her BP is increasing and we have to increase the medication. The salt level is being kept in check. Another pointer you have to really keep in mind, if any new medication has been started and the person starts feeling weak, think of the side effects. Think of the side effects. You may not be able to look into the side effects every time, in every medication in your loved ones, or maybe in yourself also, because you feel the doctor will tell. But it happened so, and that also happened in my mother, that one medication was started, and one day I had a call from my mother, and my brother said that mother is feeling very weak since last 5 days something, and the medication was started, I think around 7-10 days back, the cardiac medication. So I asked them to do all those automatic BP and this blood sugar. This was fine. So I asked immediately my brother to get her sodium potassium done, and her sodium came very low. This was somewhere around 120 or so. And then we rushed to the doctor, 120, 124. And the doctor was very surprised, and he said, Dr. Neha, how could you guess? Because this is the side effect. Now, very good doctor, very good cardiologist. Only thing is, he said sometimes it occurs. Now, my only concern is, maybe he thought that I am a doctor with my mother, so maybe I will know. No, it is not humanly possible to every doctor to look into each and everything and drugs, because it's the responsibility of the doctor who's prescribing. So that is another message, that treat your doctor patient as non-doctors, because doctor patients or doctors relatives as not having any doctor with them, because doctors get busy with their own work, and once they come home, then they get busy in their work. So write all those specific things in your prescription. And that's why I'm asking that whenever a new drug or any prescription is given by a doctor, please ask your doctor the main side effects, what can occur. Because if it could have been written in the prescription that check for the sodium level with this medication, at times sodium can go low. Or if you have some weakness sign, then check your sodium. It was good that because at times we are busy somewhere, and at times I am out of station, and sometimes I am not able to talk. So one thing is important, that we have to think that any doctor coming with patient is a non-doctor, and one has to prescribe in the prescription, and we as a responsible person also have to ask from the doctor any side effects, because we presume that it would have been told if the if there is some kind of a side effect. Because then if I would not have got this thing done, and maybe I got this thing done because I'm an anesthesiologist and always practiced I also practice as head anesthesia and critical care, and been managing those critical cases, and I have witnessed these things in old age and middle age people of having low sodium multiple times. So that's why my mind went through that, because I could have thought that my mother is old, 75 years old, and it's summers, she must be feeling low. So but it was good that it struck me, and I thank the universe that it gave me that flash that I should get my mother's electrolyte done. And she was treated, and happily since then also this complete habit of the medicine was changed. And then now as such also, as she is not able to eat that much of salt, every day without fail she takes the salt lemon water every day. Another thing is to have, after the middle age, the required amount of protein, which earlier I had to mention, to strengthen your muscles and have a muscle mass. So one must have with the consultation with the physician, must start having the protein supplements if you are not able to eat the appropriate, not taking the appropriate amount of proteins per day. So these are certain major things which I wanted to convey. I hope I could give some important pointers for everyone, all public as well as healthcare professionals, that they should also take care of themselves as well as their loved ones at home. That is very important. And I am on a mission. Building my community for exclusively for healthcare professionals, where I have these kind of knowledge based courses also, besides the courses of making online digital business as a healthcare professionals security in any kind of adversity or retirement. So please, if you are interested to come together and join my community, DM me community.